HealthBreak is brought to you by Providence Health and Services, serving Western Montana.
Congestive heart failure is the largest volume diagnosis in the Medicare age populations. Dr. Brad Berry at Providence International Heart Institute explains.
It's a very common disease, and I think we're looking for anything that will help patients live better, live longer, and there has been a lot of research out there over the years on many modalities that we commonly use currently in terms of reducing symptoms, extending people's lives, better quality of lives, but there are certainly gaps. And one of the things that interested us was vitamin D research as it pertains specifically to congestive heart failure.
So the multidisciplinary team at Providence International Heart Institute funded and ran their own clinical trial that has since been published and presented at national conferences.
Vitamin D deficiency is very associated with poor outcomes in patients with cardiac disease, especially vascular disease. And so that was one of our goals of our trial, was to see what the impact over 6 months of aggressively replacing their vitamin D and then looking at quality of life as well as other hormonal markers, and had a very significant outcome at the end of 6 months in terms of marked improvement in quality of life, and had some improvement in other chemical markers for heart failure that were statistically significant. Yeah, I think it's another example of how collaboration has worked well with the Heart Institute for patient care.
To find out more, visit montana.providence.org.
HealthBreak was brought to you by Providence Health and Services, serving Western Montana.